thank you for joining us. Today I've got with me Marilyn Glenville. Hi, Marilyn.
Hi, Kerry.
And we're talking about sort of, I guess, hormones as we age and things that we can do to cope with that period of life as we go through the menopause. And I guess one of the areas of concern at this time is also the higher risk of osteoporosis. What
Yes,
should we be doing to counter that at this stage?
it is one of our biggest risks. 1 in 2 women over the age of 50 will get osteoporosis, so it's a huge risk. So, and it's an even bigger risk than breast cancer, which is about 1 in 8. So most women fear breast cancer, but actually our bigger problem is osteoporosis risk. So we're thinking of all those factors, and the earlier we put these sort of preventative factors in place, the better. And the ones we always think about, obviously diet is important, but exercise as well. So it is use it or lose it around the menopause. We have to think of having that impact of putting a demand on the skeleton and maybe even factor in more exercise than we would have done before. I think one of the other crucial things, and I think every woman should have this checked, is vitamin D. There is a website called naturalhealthpractice.com, and there is a very simple finger prick vitamin D test, which you just prick your finger, put the blood in the vial and send it off. And of course, we've always known it's crucial for osteoporosis prevention, but it's also important in terms of heart disease, diabetes, and even cancer, especially breast cancer. So the problem now in the UK is that we have got issues with deficiencies in vitamin D, and as women, you know, we've covered ourselves up with sunscreen, but most of our cosmetics and moisturisers have inbuilt sun protection factors in there. So even when we're out on a sunny day, we may not be exposing our skin to the sun. So really important to know what your vitamin D level is, take a supplement to correct a deficiency, and then retest it. It's very simple. You're either deficient or you're not. And I would say get a good multivitamin and mineral that's got some vitamin D in, but also antioxidants, which can help slow down the aging process, calcium, magnesium, all of those, but still get your vitamin D checked, because we've had some women in the clinic where it's basically undetectable from the lab. It's so low. So it's surprising how low we can be. And then the dietary side, we're thinking of balancing acid and alkali, is making the diet more alkaline. If we become too acidic, calcium is a neutralizer and it's stored in our bones and our teeth. And if our diet becomes too acidic, our bodies literally leach the calcium out of the bones in order to neutralize the acid. So the more animal protein we eat, that's what's been the problem with some of the high protein diets that women have used to lose weight, then there can be problems with bone health. So we have to make sure that we balance it up with a good amount of fruit and vegetables, which are more alkaline, which will keep that balance between the acid and the alkaline situation.
One of the things that I picked up on one of your books, actually, Marilyn, was I've been eating an awful lot of spinach, but apparently in certain instances spinach isn't a good one to be eating.
It isn't a good green vegetable for us. It contains oxalic acid, which actually binds calcium.
Right.
So rhubarb contains that as well, but women tend to go more for the spinach thinking it's a good green vegetable. It's not. We want to eat kale, broccoli, Brussels sprouts, all of those would be much better. It's actually not good at all in terms of bone health. Occasionally it would be fine. It doesn't matter whether it's cooked or raw. The oxalic acid content's going to be there. So I would say go for other green vegetables, especially if you already know there's a risk of osteoporosis in the family, or a woman's had a bone scan and shows that her bone density is low.
Right, okay, thank you. I mean, I was quite surprised at that. It was only reading the book that I thought I was doing the right thing. Right.
Yeah.
Right, thank you.